Good evening, everyone, and welcome to the Greenwich Hospital Maternity Town Hall. My name is Karen Santucci, and I'm a professor of pediatrics and emergency medicine at Yale New Haven Children's Hospital and the director of pediatric emergency services at Greenwich. Beginning in September, I will serve in the role of Chief Medical Officer here at Greenwich Hospital. Thank you for joining us for the Maternity Town Hall. Our goal is to answer all of your questions and concerns regarding your delivery, the birth of your baby at Greenwich Hospital. We would like to provide assurance on the safety measures that are in place and will continue to be in place during your hospital stay. As a practicing physician in the Yale New Haven Health System for the past 21 years and Greenwich Hospital for the last 3.5, I can share that I have never been more proud of our health system and Greenwich Hospital than I have been in the past 3 months during the COVID-19 pandemic. The organization and each and every member of our healthcare team has risen to the occasion and beyond to keep our patients and their families safe during unprecedented times. And we will continue to do so across the board, abiding by the highest quality and safety standards. It is now my pleasure to introduce our moderator, Barbara Leaf, who is the Executive Director of Women's and Children's Services at Greenwich Hospital.
Thank you, Dr. Santucci.
You're welcome.
What I would like to do next is introduce our panelists. And we have a PowerPoint presentation. So our panelists this evening, as Dr. Santucci mentioned, I'll be the moderator. So I'll be directing the questions that are coming in for this session. And we have Gretchen Farrell, who is our lactation consultant, Dr. Kirsten Lawrence, who is our maternal fetal medicine physician, and Dr. Ro Maloney, who is one of our obstetricians, Irene Newbuyer, who's our labor and delivery nurse for the panel this evening. You met Dr. Santucci. And we also have Dr. Steve Shiz, who's our pediatrician and our medical director for pediatrics. So let's get started. And so I'm going to toss this over to Dr. Lawrence to take you through some of the past experience that we've had over the last few months.
Mm-hmm. So good evening, and thank you so much for taking the time to join us tonight. We're so happy to have the opportunity to speak with you virtually about how we are working to ensure that your pregnancy and your delivery can be safe and comfortable and a positive experience. Clearly, we recognize that women who are currently pregnant, entering pregnancy, we're not anticipating having a baby during a pandemic. And clearly, at baseline, there's anxiety about pregnancy, but we are here really to alleviate your fears, to answer all questions, and to assure you that we've really developed what we think is a safe and effective system to keep you and your family and your baby safe during your time with us here. So first, generally, and this is for all of us, either in the hospital or outside the hospital, the standard things still apply: wearing a mask, washing hands, limiting travel to essentials, and maintaining social distancing, as well as avoiding contact with people that may be ill. I mean, clearly, from what we see about the rates nationally, we are doing I think a good job here in our community and throughout the tri-state area, but it's really important that we continue to do so. So all of these are just reminders of what we should all be doing to keep ourselves and each other safe. Next slide. So within the Yale New Haven health system, the system hospitals got together very early and developed specific guidelines and protocols to keep patients and staff healthy and to take care of patients who were concerning for COVID or had COVID. So we are screening every patient when they enter our facility, and all patients and visitors wear masks. For labor and delivery and maternity, we have been given an exception in that patients are allowed to have one designated visitor, and this is the exception within the hospital. All of our staff are, well, we ask patients about symptoms and we check temperatures at the door. Our employees, all of the staff too, does temperature checks at home and are not coming to work if they have any concern for symptoms. Every patient who's admitted to our labor and delivery unit is tested for COVID-19. So if patients are coming in having scheduled deliveries, so for a C-section or an induction of labor or a version or any other type of procedure, these patients, we are giving appointments to have testing the day before they get admitted. For all other patients, when they do come in labor or with any other unscheduled admission, we're testing all patients. We also do have a system now through which we're testing employees throughout the system. What's been very reassuring is the rate so far of employees actually being positive is extremely low, less than 1%. We also are using very specific and advanced cleaning of all of our rooms and equipment, and we have specific areas for patients that are COVID positive, so that we can ensure that we can keep them safe and the rest of the staff safe. Next slide. Next slide. So as I said, we are, unfortunately at the level of the institution, we believe that it's safe to not have visitors for patients admitted. We do allow a designated support person for our maternity patients when they get admitted, and that support person stays with the patient for the duration of for the admission. So either for an admission before delivery or for patients who come in to have a vaginal birth or a C-section. So these patients and partners, we want to ensure that in the outpatient setting before the delivery, we give this information to our patients so they can make plans for care of other children, for pets, etc. And once the patient comes into the hospital with their support person, we will take care of the support person for the duration of the delivery. So we're providing food and whatever else is needed to ensure that they're comfortable. We're also enforcing social distancing within our units in the hospital in terms of nursing stations and screening and appointment check-in areas and cafeterias. Next slide. So as many of you know, at the beginning of this pandemic, we quickly had to move to change a lot of what we've been used to doing in our outpatient facilities. And I think our teams worked very quickly to develop a plan for virtual visits. So we are, doing many of our OB visits with patients virtually by video, by telehealth, and then trying to ensure that we do maximize the inpatient visits. So we have potentially fewer visits. That being said, our goal is to take the best care of every patient. So certainly, if a patient needs to be seen, we're always ready to see them. We have spaces for emergency services on labor and delivery for patients that do have issues. And then in terms of personal protective equipment, we we are lucky here at Greenwich in that we have ample amounts. We've had very generous donations from the community and from elsewhere. So I think that we have been very fortunate in that this has not been an issue for us. We have specific equipment that we use for patients who who are admitted and for whom we do not yet have a result of their COVID test. And then for patients that are positive, we do have some specific protocols that they follow. We do definitely want support people of patients that are COVID positive to be able to stay with that patient. You know, for all patients, we want them to wear masks when they're in the hospital, and for the support people too. We recognize that women in labor pushing are not going to be wearing a mask, since that's really like a marathon. And we recognize that their support person, we expect that they're going to be very close by during that time. But we're ensuring that all the staff and the patients are safe. Next slide. We here at Greenwich have really had a wonderful experience with our childbirth and breastfeeding classes in person. And we've been fortunate in that we've been able to make a lot of these classes virtual classes. So there are a whole host of classes that are available to you through the Yale New Haven Health site related to birth, related to breastfeeding, cesarean delivery, baby care, twin pregnancy, as well as newborn care. And this information is all available on our site. We also are working on a virtual tour of our hospital. We know that it's really nice to be able to show women the space that they're going to be in before they deliver. And so that's coming soon. Next slide. And just specifically to labor and delivery, as I mentioned, every patient, every woman that gets admitted for labor may designate one support person, and that's for all women. And that person needs to be that person stays for the duration of the stay. And we would really like the patients and visitors to stay in their rooms and to wear masks as much as possible. And we do help patients to move around their rooms so they're not feeling too restricted. We're not doing nitrous oxide here for pain relief, but we have a great anesthesiology team who have many other medications and ways to offer women comfort during labor. Next slide. What we recommend is that all of our patients contact their OB's office before they come into the hospital. And then although they're screening at the entry to the hospital with patients having their temperature taken, we do additional screening and ask a few more questions for patients once they present to labor and delivery. And if patients' support person is sick, has any symptoms related to potential viral infection, we will ask that they do not stay in the hospital. And after that, we'll admit the patient, the support person, and ask them to wear a mask. As I said, for patients that are admitted for scheduled deliveries, for cesarean delivery, for a version, for an induction of labor, the COVID test will be scheduled for you for the day prior to your admission to the hospital. Next slide. All of our staff has been really amazing throughout this pandemic. We've worked very closely to ensure that our patients all feel supported and well taken care of, and as well as our staff. But our priority here is to keep all patients, newborns, and their family members safe. And we really understand that pregnancy and childbirth should be a safe, positive, comfortable, exciting, happy experience, and we'll do everything we can to make that happen for you and your family here at Greenwich. Next slide. And finally, so if a mom does have a positive test for COVID-19, there are a few things we do differently when they're admitted. There are a few extra laboratory studies that we send. Although, the patients that we have had recently that have had a positive test generally have been healthy and not had symptoms, but we still want to ensure that we're checking patients for kidney issues and for issues related to blood clotting. As many people have seen in the press, those can be complications of a COVID. So we make sure that we monitor those in labor. And then we have specific guidelines for the best way to take care of you and your baby after the delivery in order to reduce the risk of transmitting the infection to the baby. Next slide. So thank you very much. And we would love to move to our question and answer period.
Great. Thank you, Dr. Lawrence. So let's get to some of the questions. The PowerPoint was a great overview for all of you, and it allowed us to receive some questions. So the first few questions we'll ask Dr. Maloney to answer, and this seems to be a theme regarding before you come to the hospital. And the first question, Dr. Maloney, is if my husband and I have already tested positive for the virus back in March and are due to deliver this summer in August, are there any things we should watch out for, or are there additional precautions because of this? Is Greenwich Hospital, second question, is it a research hospital where there would be interest in examining my placenta based on recent studies that have come out?
Well, let me answer the second question first. To put it in terms that I think everybody can understand, we're building this plane as we fly it. So there's plenty of research that's coming out with regard to what do we do now that we're four months into this. As Dr. Lawrence so eloquently spoke, she was very humble to not say that she was on the forefront of making sure that our patients and staff were safe at Greenwich Hospital. So we want to give her kudos for that. And that's just the caliber of physicians that we have here at Greenwich Hospital. With regard to the second question, patients that were previously tested and positive for COVID still get a COVID test and the rationale for that is that the specificity, that means the patients that are known to be positive and continue to be positive as far as the antibody is concerned, is not there yet. So we're still working on that part of it. So we're still going to test patients for COVID when they come in. We're not going to test the partner, but we use all the normal precautions. And what are the best precautions for mitigating transmission of COVID? Washing your hands, social distancing, wearing a mask. And our staff does that very, very well. And that's why our numbers as far as hospital employees that are positive is so low. And the state has done a great job with that. The entire system, Yale New Haven Hospital has done a great job with that. So they would be tested. With regard to some of the things that we do in the outpatient setting, if I can go a little bit more in detail about that, we have changed the way we see patients. For years, we saw patients every 4 weeks. Now we combine that with in-person visits and telehealth visits. And the nice thing about having young women that are pregnant is that you all are on social media, so it's very familiar to you. It's different with the geriatric population who still want the in-person visits. So your first visit is usually a telehealth visit. That way we get information about you and we limit the amount of face-to-face contact. When you come in for your first prenatal visit, we do your blood work, your ultrasound for dating, and any non-invasive prenatal testing. A lot of women know that as the gender test. It gives us a lot of more information than just the sex of the baby. and we utilize that information to determine when your next visit is. Certainly, if you're high risk or you have any vaginal bleeding or any other issues during the first trimester, we'll see you more frequently. But then we alternate between in-person visits and telehealth visits. Once you get into that last month of pregnancy, all patients are seen in person. And certainly if you have any high risk factors, you're seen more frequently. We're not just going to say you're fine. We don't want you to come in because we don't want you to get exposed. No, we're doing the same thing in NEMG that the whole system is doing, inpatient and outpatient with Yale New Haven Health. And that includes screening at the door for temperature, questions that will be asked of you by the staff. All the staff are wearing masks, and the physicians are wearing masks as well.
Great, thank you. There's two more questions related to before a patient comes into the hospital. Can I bring a support person to my prenatal appointments or ultrasounds?
At this point, we are not allowing a guest or a support person to come for ultrasounds, but certainly you can FaceTime or use any type of video, I don't know, whatever your phone allows you to do, but definitely FaceTime. I have an iPhone. So you can utilize that. And most patients are understanding at this point. No siblings, no small children. The main thing is that we want to mitigate any possibility of infection or transmission of virus. The other part of that is that, again, as we continue to open up, we'll probably start allowing guests to come in as well. But right now, today, was it June 24th, just the patient at this point. And patients have been very understanding of this. And that's why I think Connecticut is doing so well and the numbers have gone down so dramatically, because patients understand what is going on and the need to decrease the risk of transmission.
Great, thank you. And one more for the pre-hospital. Does having COVID increase the chance of miscarriage or preterm labor?
Well, again, all the data that's coming out is new data, and it depends on who you read, what happens. So far, it doesn't seem to be that, but again, I'll defer to Dr. Lawrence, who's the maternal fetal high-risk specialist regarding that. Our main issue with patients tend to be if they test positive for COVID and the immediate postpartum period, they're more at risk of developing thromboembolic phenomena such as blood clot. So, but I will defer that question to her.
I think, right, so as Dr. Maloney said, I mean, this is new for all of us, but I think what we do know now from the data that's come from Asia, especially, and early data from this country, is we don't believe there's any increased risk in miscarriage or in birth defects, or actually generally in other complications such as having a baby that's small for gestational age or preterm labor. And I think we're also finding, we were concerned as this started that women who were pregnant were at risk to get really sick, such as women do with the flu. I think we haven't seen the complication rate as high as we have with flu in the past. But as Dr. Maloney said, I mean, generally when women are pregnant, we are concerned that they're at a higher risk of having blood clots. And since we know that part of the process of inflammation with COVID-19 is a higher risk for blood clots, this is something that we're very cautious about. And so there are a group of patients, even women that don't have any symptoms, that will end up sending home on a low dose of a blood thinner for 2 weeks, just to make sure that they're safe and that we can lower that risk.
Great. Thank you. Dr. Maloney, you have two more questions. Has the number of days to stay in the hospital postpartum, has that changed?
Yes, patients want to go home. they're excited to say, you know what, I'm glad my baby and I are fine. I've had a beautiful experience here, but I want to go home and be with my family because, you know, I have small kids at home, or, you know, my parents are nearby. So certainly our days are the same as far as the hospital is concerned. You can still stay 2 days for a vaginal delivery and up to 4 days postpartum for a cesarean section. But most of our patients have decided that, you know what, I'd really rather go home and recover at home. The good news is that we are available by telehealth. We encourage patients to sign up for My Chart. Our nursing staff is phenomenal. I mean, I'm sure somebody's going to speak later about breastfeeding and so forth and so on, but they give their cell numbers. So it's not like we send you out the door and wave bye-bye. We're still in touch with you. Most of the physicians are available to you through telehealth, through their particular practices, and that also helps.
Great, thank you. And the last one related to before the hospital, does my spouse have to stay, and are they allowed to leave the hospital and then come back?
Unfortunately, today, June 24th, if they come into the hospital, they must stay in the room, and we'll provide, as Dr. Lawrence said, we'll provide them with something to eat. And if they leave the hospital, unfortunately, they will not be allowed to come back. And again, it's about the safety of mitigating exposure and transmission of the virus.
And Dr. Maloney, as you were referring to and giving the date, things are changing. They're changing around the state, and there are some discussions about changing and lifting some of our visitors. So stay tuned, everyone. Keep informed with your physician, and certainly you can always call, you know, one of our hotlines. Thank you. So the next few questions are related to testing for COVID-19. So I'll ask Dr. Lawrence to answer the next few questions. Let's see. One of them is, does everyone, patients and partners, get tested, and at what point in the process? So I think we touched on that, but do you want to be a little more specific?
Definitely, we have patients that we, you know, have tested during pregnancy because of symptoms concerning for COVID-19. But in terms of planning for the delivery, we are testing every patient who gets admitted for childbirth. So as I said before, women who are coming for a scheduled delivery or a scheduled procedure will be scheduled for an appointment outside in our tent the day before. That's really worked very well. I think patients go and they are seen within 15 minutes. They don't generally have to get out of their car. And those results come back usually by the end of the day before the admission. And then for patients that come in for unscheduled admissions, either for delivery or other pregnancy complications, these patients will get a nasopharyngeal swab when they get admitted. And we are lucky in that we have the ability to get those tests back within 2 hours. So that's really wonderful. We are not testing partners, and that's because, you know, we're not generally doing procedures for the partners, but we do advise that partners, as we said, wear a mask for the duration of the hospital stay, and that's to protect, you know, themselves, to protect staff and their partner.
Great, thank you. One more. If the mother tests positive for COVID-19, can she refuse separation from the infant? What happens? And I'm happy to have you answer this, Dr. Lawrence, because I know this is near and dear to your heart.
Right. So certainly this is, I think, a place of, you know, that's fraught with some challenge, where we recognize that you know, bonding with the newborn is so crucial and important to moms with a new baby. What we do know, and this comes from the CDC, is that, you know, limiting skin to skin contact directly after the delivery is the best thing we can do to mitigate viral transmission to a newborn. So we don't think that there's a risk that for what's called vertical transmission, where the virus can pass from the mom to the baby before the delivery, but we do believe that there's some risk thereafter. So the recommendation, the current recommendations from the American Academy of Pediatrics and the CDC is that babies born to moms that are COVID positive are separated from the mom by 6 feet. Babies are bathed, the mom, directly after the delivery. Moms are recommended to pump, to shower, and then to pump and have a healthy caregiver feed her baby. Certainly, this is a recommendation. We recognize that families may, desire to continue to breastfeed, and as Dr. Maloney said at the beginning of this, there a lot of these real answer to these questions are still unknowns, but I think we're going on the best data that we have. We do know that a mom who's COVID positive that's been through labor will have virus on her skin and on her gown, and I think that that's why we want to ensure that the baby is safe. And then babies that are we do still recommend rooming in for babies that are healthy, but rooming in a bassinet 6 feet from the mom, with the feeding of the baby done by a healthy caregiver. And then every newborn of a mother who is COVID positive will be tested at 24 hours of life. And to this point, we have actually had no babies that are positive.
Great, thank you. One more question. Do the staff on maternity floor work with COVID positive patients?
Do the staff? Yes. Our staff, we screen patients, and our rate of positivity of asymptomatic positive patients is about 5%. That rate is going down. But yes, we have, when we have patients that are positive, the staff cares for them and continues to provide the best obstetric care through the delivery, but they are properly equipped with protective equipment.
Mm-hmm. And this is an interesting question. Do the moms need to bring a face mask? I think that comes from all the talk about PPE and shortages.
Right. I mean, we give face masks to patients when they enter the hospital, but patients can bring face masks themselves as well.
Mm-hmm. Great. And do the patients need to quarantine before the due date? And if so, for how long?
I mean, what I would say about this is that as I said at the beginning, I think the rates in our communities and in our state have definitely gone down, and that's really amazing. But I think it's related to the social distancing and the safe way that people have gone about living their lives, wearing masks, washing hands, limiting interaction with others. So I think that those continue to be recommended. I wouldn't necessarily tell a woman now, who's about to have a baby, that she needs to quarantine. I think getting outside, exercise, all those things that are really important for your well-being, you should keep doing. But I think avoiding, big social gatherings and avoiding, being in places where we think the rate of infection could be higher is probably a good, smart thing to do.
Great, thank you. One more. If I've had COVID-19 and I am breastfeeding, can I pass immunity on to the baby?
So we do know that there have been antibodies identified in breast milk. And we know that there have been, there have also been antibodies identified in cord blood. So I think that, you know, generally we really recommend, and you know, we really want to support of all of our moms breastfeeding, because we know that breast milk has so much in terms of offering immunity and immune function to newborns. I think the specifics about what that increased immunity is for babies of moms that are COVID positive, I think that's as yet unclear. But I think it's absolutely very safe and definitely recommended that moms continue to breastfeed.
Great. Thank you so much, Dr. Lawrence. The next few questions that we have are related to once you're here and in labor. So I'd like to ask Irene Newbar, our labor and delivery nurse, the next few questions. So Irene, has anything changed in regards to getting to the hospital and checking in? Oh. I think we just need to unmute Irene. She ready? Dr. Lawrence, since we have you on the screen, do you want to answer
Sure.
that question?
Yeah, no, I think what we
Yeah.
want to, you know, it's great if patients that are coming in labor contact their OB's office, contact the hospital labor and delivery before they arrive, so we know that they're here. You know, from during the day, they come to the main entrance, and patients will be have their temperature checked and be screened and given a mask if they don't have one. Until a patient is admitted, we are advising that their partner waits outside, so stays in the car. And then for patients that come in overnight, those patients will come through the emergency room, but similarly, they will be screened and brought directly to labor and delivery.
Great. And I think Irene, do we have Irene?
I think you do. Can you hear me now?
There she is. Great. That's okay. Dr. Lawrence pinch hit for you, so
Okay.
you're all set. So a lot of these questions have to do with checking in. So where do they check in?
Well, when they come in, at first they come in through the front entrance and they're met by a healthcare person. They'll have their temperature checked, and then they'll be sent up to us on the third floor. Once they get to the third floor, they'll be greeted by one of us nurses outside of our unit. We'll again check their temperature. We'll ask them some questions about if they've been exposed or if they've had any symptoms. And then we'll bring them in to the unit, into one of our labor and delivery rooms, settle them into a room, and you know, get them settled and get the process moving for their labor experience.
Great, thank you. There's a question here about, do they enter through the emergency room? Can you just clarify that? Dr. Lawrence did touch on that.
I mean, during the day, they can come in through the front entrance, but after 7 o'clock at night, the front doors do lock. So they can come in through the emergency room, the valet parking area in the evening, and there is a healthcare worker there in the evening, which will greet them there. Same process. They'll take a temperature, you know, assess, and then do the same, send them up to us.
And Irene, so that's the process for someone who's in labor, but what
someone
if
who's
they're
in
not?
labor. Even a triage, if someone's coming in and they think they're in labor, or maybe they think they've broken their water, or any kind of an issue, they'll be sent up to us so that we can triage and assess them.
Yep, and their partner is?
They will not be able to come up at first. The partner will not be admitted upstairs until the person is admitted to the unit, and then their partner will be able to come up once the patient is staying.
Okay, great. And what if there's been a long, you know, length of time and the partner has not heard from us? What would you recommend they do so that we don't forget that they're there?
I mean, everybody has a cell phone, so we do ask them that they keep in touch with their support person, keep the line of communication open with them, so that they don't forget them.
Okay, great, thank you. And do the patients still pre-register?
Yes, everybody does pre-register. They do fill out paperwork in their offices. They should check with their doctors, you know, ahead of time, so that they can get the paperwork filled out.
Great. And what are patients allowed to bring into the labor room, and what should they not bring to the labor room?
Well, everybody should come prepared for the labor experience. They should have prepared ahead of time. They should have a car seat installed in their car, rear-facing car seat for their baby for the trip home. When they come in, they should bring the carrier up to the unit. They should have everything for the labor experience with them. They should have their cell phones with them or their iPads. They should have the chargers for charging their equipment. And then they should have their toiletries, pajamas, slippers, things like that, and especially for the support persons as well. For their maternity experience, the same thing, whatever they need for their comforts for after delivery. For the baby, they really don't need too much because we supply a lot of the things for the baby for afterwards. The baby will have a crib, they'll have diapers and wipes and all of that, but an outfit for going home, receiving blankets for their trip home. But now what has changed for this is support persons should have snacks and drinks, kind of things for their stay. They can bring that with them since they're not able to leave. But as has been mentioned earlier, we do supply all meals for their stay.
Great. And at this point, the support person, even though our cafeteria and garden cafe are open, are they allowed to go off the floor to get any meals? Again, knowing that things may change, but at this point right now.
At this point in time, no. Once the support person is admitted into the room with the patient, they are not allowed to leave or to walk around the floor. They have to stay in the room with the patient. So we will provide all meals and drinks to make them comfortable and make their stay happy.
And the rationale for that is to decrease the risk of exposure, correct?
That's correct.
Right.
To keep everybody safe.
Right, very good. And then the question here is, what are they allowed to bring to postpartum, and what are you not allowed to bring to postpartum?
I mean, everything they bring with them into the labor room, they can bring with them to the postpartum room.
Mhm.
So,
So plan ahead for the
plan
whole.
ahead for their stay. So comforts, all clothes that they need, pajamas, and snacks and, things like that is pretty much all that they need. Their iPhone, their iPads, their chargers are very important. Outside of that, they really, they don't really need too much else.
So since there aren't any visitors, are they able to bring obviously a phone for FaceTime, but if they have a tablet?
Absolutely.
Okay.
Highly recommended. They can, put movies and music on their tablets. It's very
Mhm.
useful during the labor experience to have, different genres of music and movies, and it's kind of a nice experience for the couples.
Good. Okay. The other question has to do, could you describe what they can expect for a vaginal birth, for, whether they're positive COVID or not? What are we doing for that?
It'll be the same experience for a positive birth versus, a positive patient versus a negative, with just more protective equipment. We just have to use more, masks and gowns and gloves, then, we're still using protective equipment regardless, but the experience is the same. We care for our patients the same. We want to make it a special experience for them. It's a milestone. It's something that we want them to remember and look back and, really enjoy, and, that it's something really special.
Great. Thank you so much.
Yeah.
So the next few questions are related to after the baby's been born. And so I'm going to ask Gretchen, our lactation consultant, to answer the next few questions. First one is there still a photography service available in the hospital? Yep. Gretchen, I think you're on mute too. Nope. Hey, Gretchen?
I unmuted myself. I'm unmuted. Let's see.
So Gretchen, we can't really hear you too well. Can you turn up your volume or?
Hi, can you hear me?
Yes, there you are.
Sorry,
Yay.
a little while.
Yeah.
Um, So I was saying Bella Baby Photography is the service that's affiliated with Greenwich Hospital. At this time, due to COVID virus, they are not available in the hospital to do the photography sessions with the couples and the new babies, but they are available after you go home and after you are discharged for private photo sessions. And so we will give you all the information you need so that you can arrange that after the visit.
Mhm. Next question is pretty simple for you, I think. Is lactation support still being provided?
Yes. So we have a wonderful team of lactation consultants here at Greenwich Hospital, and we are here every day, 7 days a week, and we see every patient one-on-one every day, and we're here to support your breastfeeding experience in any vision, any way that you like.
Mhm. And do you want to speak a little bit about the rooming in and the advantages for breastfeeding with that? Oh,
COVID positive patients, are you asking about?
yes,
Okay.
yes. Rooming in, how does that work?
So if there is a healthy caregiver or a healthy partner with you and you have tested COVID positive, your baby can room in. As was spoken about earlier, a bassinet will be provided, a covered crib for the baby, which will be placed 6 feet from the mom. And then the caregiver can do the care as well as feed the baby. If mom is choosing to breastfeed, we will support her and set up a pump and show her how to do that so that breast milk can be provided for the baby by the healthy caregiver.
Mhm. So Gretchen, what if, the question is, what if my baby is in the NICU?
So in the NICU, honestly, I don't know the answer to that question. I'm very sorry. Whether mom, I believe the healthy partner or caregiver can go and be with the baby in the NICU. Mom, again, can pump milk while she's in her room, and that milk can then be brought by the healthy caregiver to the NICU to be provided for the baby.
Mhm. And part of the reason for that you're not sure is because we haven't really had that experience.
Correct.
Our babies have been pretty healthy, so there really haven't been any issues.
Yes.
One question, patient is planning on having a family member stay with them to help with the baby. Should they still do that? And I suspect that's once they're home.
So that's a great question. You know, if you've been quarantining together and everyone is not COVID positive and is not asymptomatic, that probably will work to have family, but we do want to maintain social distancing. And if we're not sure if someone has been exposed or someone's positive, we have to be careful about not exposing the baby and mom.
Great, thank you. And you haven't experienced any particular difficulties with our patients for lactation, whether they're positive COVID or not?
No, I know our nurses and the lactation consultants are all available every day to give mom all the support that she needs.
Great. Thank you, Gretchen. So sort of last but not least, but extremely patient is our pediatrician, Dr. Shiz. And so he's going to answer some questions about discharge and a little bit about newborn care. So Dr. Shiz, the first question is, will we have to leave the hospital earlier than usual?
Well, at the beginning of this horrible pandemic in March and April, we were encouraging families to leave early. Currently, we have, I think, maybe one COVID patient in Greenwich Hospital.
Correct.
And we have, so it right now, it's really an individual decision that parents will make.
Mhm.
So pre-COVID, for vaginal delivery, most families were staying for 2 days. For a C-section, they were staying for 3 to 4 days. And I think we are seeing a combination of people leaving early and others wanting to stay right now in mid to end of June.
Right, and just some of the statistics, there is only one positive patient right now in the hospital. There are 139 non-COVID patients, and throughout the health system, which is all 5 hospitals, we're down to only 49 positive patients. So just to give a little bit of perspective for our audience, I think, like you say, a lot of the prevention measures are really helping all the declining. The next question is, what are pediatricians' offices doing to make sure infants are safe and newborn visits and vaccines?
So I'll speak for myself and our practice, but knowing all my colleagues, all of the pediatric practice are doing very similar thing. Number one, we are separating well visits from sick visits. We are having nobody in waiting rooms anymore. All of our wonderful toys and books have all been put away. And as Dr. Maloney said, parents come, they are in the parking lot, they call, all of the information is taken, and then they are directed up to a room. All of the staff, as well as the physicians, have the proper PPE. I know in our office we installed a plastic barrier like you all may see in Stop and Shop or wherever you shop, between our front desk staff and the patients. We are currently limiting one parent per visit and doing either Skyping or FaceTime for the other partner. In between visits, the room is cleaned, and in between the sick and the well and sick times, the whole office is cleaned. And currently, the sick time, we are evolving as healthcare is evolving. Some is telehealth and some is actual visits. Now, we are doing some telehealth for newborns if there is an issue, but we are also definitely seeing babies in office. And what is critical is we are continuing the vaccination schedule from the American Academy of Pediatrics. So we are currently really getting back into our offices our infants and toddlers that need their vaccines.
Great, thank you. So here's one question. How long should other family members practice social distancing after returning home?
Well, what I've been saying pre-COVID was that I would not like a newborn out in crowds for 8 weeks until they get their first major shot. What I'm saying during this period is, other than the immediate family, I am not encouraging particularly grandparents to actually hold babies, perhaps out in a yard, if you have a yard, with masks 6 feet away to see the baby, and somewhere between 4 weeks and 8 weeks, perhaps hold the babies. Currently, after 8 weeks, most babies and toddlers are not going anywhere. So it is not that they are now going on planes or to restaurants or to friends' houses or traveling.
Okay, here's one more question. Question is, hold on. It's about the nursery in the hospital. Can I have my child in the nursery, or do I have to have my child in the room?
Well, if a mother is COVID positive, then the baby must stay in the room. We pre-COVID were encouraging, with best practices as a hospital for breastfeeding, to have babies stay in 24-hour rooming in. But is that something that must be adhered to? No. But we are encouraging it.
Great, thanks. How will we know if the newborn baby has COVID-19?
Well, thankfully, first of all, this has been an age group that has been, for the most part, spared COVID-19. But for any newborn who, when you take home, whether it's a 2-day-old or a 3-week-old, my advice is, if the baby seems in any way, shape, or form off to you, not feeding well, more irritable, more lethargic, coughing, definitely fever, and I encourage all mothers and fathers learn how to take a temperature rectally and get a rectal thermometer. So in the first 8 weeks, if a baby's temperature is less than 97 or greater than 100, they should call their pediatric practice list right away, because babies present with mild symptoms and can also, with these same mild symptoms, have more serious illness. So there's nothing specific about COVID-19.
And is there anything special to prevent the siblings from being near the baby?
Well, you're not going to prevent siblings to be near a baby. We encourage that. Obviously, if a sibling is sick, then we need to see that sibling. We need to find out quickly what the issue is and see if it makes sense to have that sibling either at a grandparent or in a different location. But just like we like families to grow and welcome a newborn and even pets, I don't think it's really necessary to have siblings not be near newborns.
Great, I'm sure there's a lot of happy siblings to hear that. What is
It depends on the age of the sibling.
Right.
There are happy siblings, and some 3-year-olds are not too thrilled.
That's very true. What is the process if I'm positive for COVID-19 after discharge?
If you're positive after discharge, so that would mean you've been feeling ill and have either gone back to your obstetrician or to your general practitioner. So it would be in the newborn period, then it would be probably a reinstitution of trying to be 6 feet away, trying to express and give breast milk in a bottle. And usually what has been is once the mother is well for 14 days, we assume that they can then go back to nursing. I have not had that experience. I don't think too many pediatricians have, thankfully.
Right, agreed. Is there any testing for the baby after discharge if the mom was positive at some point?
There could be testing arranged, just like we can test any age group. And again, if in this special situation, if the mother was positive, it might be applicable to test other family members, including a young infant.
Great. Well, thank you, Dr. Shiz. We're almost out of time. So on behalf of the panelists, I would like to say thank you for all your questions. And I just want to toss it to Gretchen, or if you're able to, patients are asking, should they bring their own breast pump? Uh-oh.
We do have, can you hear me?
Yes, now we can.
We do have patients bringing their own breast pumps, but just to know, we have many breast pumps available for use, which are multi-user breast pumps, which are safe to use by our patients.
Great, thank you, Gretchen. And so I'd like to toss it over to Dr. Santucci for a few words to close out our town hall.
In closing, I would just like to say that it's really been our pleasure to reach out to you and to share this information during this very exciting time in your lives. And we want you to know that at Greenwich Hospital, we are all prepared, and we are so looking forward to welcoming you and your baby to Greenwich Hospital. Have a good night, everyone.